Welcome to Connect. I'm Sue Hernandez. On today's episode, we're talking about family self-sufficiency and what homelessness looks like in Marin.
How would you describe what homelessness looks like here in the San Geronimo Valley?
We have your typical homeless person that you'd see and say, okay, that person's probably homeless with his backpack that sleeps up in the woods. But we also have a lot of what they would call precariously housed people, which are people that are house sitting or couch surfing or things like that, that when you bump into them on the street, you just wouldn't imagine, because it's not what we preconceive as homeless. That doesn't mean that they're not facing a lot of the same problems that the other homeless people are facing, and to a lesser degree also, because they do have a shower and things like that. So most of our homeless people are in this precariously housed zone where they don't know from week to week where they're going to be staying. They don't have enough money to put down a deposit for rent. They don't have enough money to pay rent and utilities and all that. So they're just barely scraping by with the generosity of the people that are around them, housing them.
And what services do you provide to help them?
Well, we have the food pantry, which is probably our main way of getting in contact with that population. And we're open twice a week. We do USDA once a month. So that definitely opens the door for them to come in and start to see what other services are out there. We also offer the health fairs, they're all free, and they'll have immunizations. We have alternative practitioners that come in if they're more of that kind of a bent mindset, if that's what they're into. And we do blood pressure and blood screening and diabetic screenings and anemia screenings and things like that. And we have between 6 and 8 of those a year, so that people can at least come in and start to get into the health system. And with a lot of these fairs, we also have the county come out and sign people up if they do qualify for Medicare and Medicaid, because as people become more isolated, they forget to continue to reach out, and they find themselves in bad situations, and then they just don't know where to go. So we offer those services also.
You're bringing together a whole community, but you're also looking at the whole person. You mentioned maybe it's dental issues, mental health issues, transportation issues, looking at the entire human being and all of their needs, as well as the whole community.
Well, as a community has a lot of different parts, us as human beings have a lot of different parts. We have a lot of different needs. We have mental needs and physical needs and emotional needs. And to, once again, focus on just one part of that is missing the wholeness of what makes a person a rich person. And in the community, to focus on just one aspect of what's going on in the community, you negate the richness of what the community has to offer.
The Odyssey program is an intensive case management team that supports individuals who have a diagnosis of a mental illness, as well as having been homeless or are currently homeless. A lot of folks who have struggled with mental illness and also have been homeless are often fairly isolated. So a big portion of our job is to help folks get back into their lives. And that can look like getting just housing. It can help them get back into employment, back into volunteer work, reconnection with community. It is very isolating that they are feeling very much on the margins of society. People walking down the street, not looking at them, not talking to them. Struggling to just get by and feel part of, as we all want to do, feel part of a community. Just getting by daily is a struggle. And oftentimes people talk about that's the bulk of their day, is just functioning, working out where the next meal is going to come from. You have to have a date book to get appointments. You have to have a way to track what's going on, a place to put your papers. One of the things that people often say to me is, and they lose papers all the time, like my appointment papers or my Social Security papers. Well, they don't have a file system at home to put this in. In addition, people who have been homeless or are homeless also have an incredible lack of resources and an ability to get around. And if you compound upon that, someone who's also struggling with a mental illness, maybe hearing voices or just incredibly depressed, so the motivation to get up and take care of their lives is impacted by their mental illness. Or if they're experiencing psychotic symptoms and they're not in the same reality as you and I are most of the time, that provides an additional challenge to just planning your day. Some folks are already sort of plugged in with benefits, so they have Medi-Cal or CMSP or something of that nature that they can go to the Marin Community Clinic and get some services. But a lot of people don't, so they end up using ERs or they end up just not getting treated, which leads to further problems down the road. So I think the misconception is that people want to continue living that way, that people don't want to be brought into the rest of our community. And I think that that's one of our goals too, is in when we're helping people write out their plans of recovery, what they want to achieve in their lives and how they want to get back. And that's often what we hear. I want to get back into the community, or I want to go to school, or I'd like to take a class, or I'd like to be part of something. And giving people the opportunity to do that and to know that they're welcome in the community at large is a huge, I think is one of our huge challenges. So one of the misconceptions is that people just are happy living that way. I don't think that's true at all.
And now, Dr. Larry Meredith, Director of Health and Human Services, talks to us about family self-sufficiency in Marin.
Some years ago, the Self-Sufficiency Index was explored as an alternative to the federal poverty level. The federal poverty level is a measure that was developed in the mid-60s by the Department of Agriculture because food was such an important part of the cost of daily living. And that measure has withstood the test of time, and it's still here today, even though the same threshold that's used for Marin is used in Mississippi, where the costs of living are dramatically different. So over the last 8 or 9 years, the Self-Sufficiency Index has been developed so that it can look at the array of costs that are associated with daily life. In Marin County, there are about 100,000 households, and we estimate that about 1/3 of those households are at or below the self-sufficiency level. And just so you get a sense of that, for a single parent and 2 kids, it's about $68,000 a year that would be required to cover all the costs associated with getting the kids back and forth to school and daycare or childcare and travel and housing and all the stuff. If you then apply the federal poverty index on that, because that then means who's going to get food stamps, who's going to be able to access public assistance or some of the other things, it's about 8% of the families. They're about in the order of 3,000 families that are living below the 100% of the federal poverty level, which for a family of 3 is $16,000. Now, you can see the difference between $16,800 to $68,000. So how do we help these families? The safety net in Marin, I don't think I would characterize as being adequate. I think we are going to be using some of the stimulus money that's coming forth to address some of our needs, but that's one-time money. The increasing numbers of folks who are homeless, I mean, talking about housing, I mean, low-cost, affordable housing is really part and parcel of the problem here in Marin. My sense is that there's enough housing in Marin, but our allocation of the housing is at odds with our needs. Marin received about $660,000 as part of the stimulus package for homelessness prevention or rapid rehousing. And so we have engaged our nonprofit community in being creative, get creative with this. How can we use this money and leverage it so that we can make sure that we stem the tide of homelessness and rehouse those folks who may have been displaced as a result of the economic downturn.
And here are a few examples of some resources you'll find in Marin. Thanks for watching Connect. I'm CEO Hernandez, reminding you to listen with all your senses, know your community, and connect.